Everyone, today's video we are going over top 3 reasons why your hip may still hurt after your labral surgery. And at the very end of the video, we'll go over 2 things that you can try to see if it helps with your hip pain. If you want to hear me talk a little bit more about these top 3 reasons, kind of educate you a little, stick around in the beginning here, okay, and I'll go over that. If you're just here for 2 things that you can try to get rid of your hip pain, then go ahead and fast forward. Use those little stamp markers along your video to find exactly what you're looking for. That's there in the end for you, okay? My name is Dr. Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa, California. At some point in this video, you may notice a free gift that pops up. You can take advantage of it if you like. It's a wonderful free webinar that we've put together, top diagnoses of hip pain, things that you can do about it, some educational stuff. So please take advantage of that. A lot of times people will watch our videos, want to know what to do next. Honestly, that's your next step. Click on that, and that's going to guide you in the right direction, okay? So top things that we notice people come into our office after maybe a labral surgery and they still have the same hip pain, or maybe even just hip pain but in a different area, okay? I want to say one of the major reasons I see this is still an issue is because PT was not hard enough for them, okay? And I'm not here to talk down or bad about anybody out there, but we may notice that at some point along our journey of going through physical therapy, whether it be before our injury or after we've gotten this surgery done, that it's just not challenging enough. I see people walk through the door, they're stuck with doing some fire hydrants, some clamshells, some simple core exercises, things of that sort that maybe they helped for a little bit. They noticed that maybe their pain isn't as much or as frequent, but it is still there, and it is still preventing them from being able to do things years later down the road at this point. I have noticed that once we put them into a more challenging rehab course, we take them through more individualized care, make sure that the exercises that they're doing are challenging enough for them, okay, are not hurting them, and are actually making them feel better afterwards. They're not just going home with something that doesn't actually make a difference. That's when things start to change. If you've been stuck in the care of being sent home with a piece of paper of exercises that you weren't necessarily taken through or didn't change anything for you in your PT, honestly, you gotta find something better. There's too many people out there who are now stuck as surgery candidates when they haven't even been taken through the right amount of care first. So top reason why you may still have pain after surgery is because you haven't been taken through the right type of rehab, the right type of movements, the individualized care that you need, the challenge that you need, okay? If that feels like you and you're being put into that category, we're here for you if you want, or just go look for someone that's going to challenge you a little bit more, someone that's going to put some weight in your hands, someone that is going to build you back to whatever your goals are. At some point, you got to get foot on ground, make things look more functional, and actually test the things that used to hurt you before. You should be seeing change, and you should be seeing it fairly quickly, okay? Second reason why people may still have pain post-surgery in their hip is because nothing changed about their habits, okay? That's the beauty of rehab and an individualized program, is that something got us there in the first place, right? And we may need help figuring out what it is. If it wasn't a true traumatic event that blew out your hip and that's the reason why you needed surgery in the first place, but maybe it was one of those gradual things, you started to notice it more and more, and you know, we just didn't take the necessary steps to actually change some of the things that got us to that place in the first place, then that's what we notice about people who still have pain afterwards. So just because we got that structure repaired in our surgery does not mean we go back to the normal things in our life that we did that got us there in the first place, okay? That doesn't mean that you have to stop running because running got you there, or weightlifting because weightlifting got you there, or insert whatever activity we're talking about. We're talking about simple little habit changes throughout the day. It's kind of like when you want to lose weight, okay, and you want to find a healthy weight for yourself. You may find yourself in the routine of changing things, but if you want to stay there, you want to feel better a long period of time, you change these small habits and you notice later on down the road that we have seen this progress. It's the same thing when it comes to injury and pain. Something has to change for you to notice a difference. You can get the surgery, you may notice an improvement in pain, but your function has not changed. Nothing about what got you there in the first place has changed. So habit changes is something that we always discuss with our patients in the office here. As always, one of the first goals of the first appointment as well is what got us here, what could be scraping the scab off this injury continually, or what is it that we need to do a little bit more of to help promote healing better, okay? We talked habit changes. We talked about more challenging PT and rehab. Last thing is maybe that the surgery that we got, unfortunately, wasn't your pain generator. I have seen this and heard this a lot. They go in for the labral repair, they come out, there is no change. I've seen the same thing in the knee, in the shoulder, and the neck, all kinds of stuff. We may have found that there was a labral tear on your imaging, you got it repaired, and now we're still stuck with the same pain afterwards. It's unfortunate that things like this happen, but that's kind of where we're gonna go into next, that if that sounds like something that you ended up dealing with, I want you to try these next 2 exercises. One of them, if it was really truly a labral issue, the thing that we're gonna try shouldn't actually make you feel better, okay, if the labral tear is the true pain generator for you, okay? So we're gonna try something really simple. It's almost like a little magic trick. If it works for you, it's probably not a labral issue, probably something else. Again, the webinar can help take you through the educational aspect of that if you wanna know more about why that works. And then we'll get into a second exercise afterwards. For those of you who think maybe your PT wasn't hard enough for you, I want you to try this exercise that we're gonna do, okay? So hopefully some of that information I gave you, 1, made sense, but 2, kind of helped highlight some things for you and why you may still be here with this pain and dealing with it. So we're gonna try a simple little magic trick. If it doesn't work for you, that's totally okay. That's why we go over all the things in our webinar of if you didn't fall into this category, maybe you fall into this category. But what I want you to do is try some things that provoke your hip. Maybe sitting like this is what does it, or kind of bending forward a little bit more, or getting up and out of a chair. Try the things that you notice some of your discomfort with. I don't want you to debilitate yourself, but something that you have always noticed a little bit of an issue with. Test it now, try what we're gonna try, and go back to it, okay? Skin rolling. Some of you have maybe noticed this on some of our other videos. Maybe this is the first time that you're hearing about it. But what we're gonna do is we're gonna kind of turn around here. We're gonna find the back side of us here, okay? I want you to find that little pointy bone at the bottom of your hip here. So if you were to take your hand and kind of rub it across the top of your butt cheek, you'll notice a pointy bone back there. I want you to go right above that and grab as much skin as you possibly can back there, okay? The skin is the most important thing. If there's some excess fat, that's totally fine too. Just grab whatever you can grab and just wiggle the crap out of it, okay? Wiggle, wiggle, wiggle. It may be a little tender, maybe in a little bit of forward and backwards, so it feels like that skin's gonna pull out of your fingers, and then we're gonna go to a different area. We're gonna follow the top of our hip bone here, okay? If you put your hands on your hips, you feel your hip here. I want you to, again, grab the skin on the side of that, on top of that hip bone, wiggle, wiggle, wiggle on the side there as well. Maybe do a little hula hoops, okay? May feel a little bit tender. Hold on to that skin as much as you can. If it keeps slipping out, no big deal, just grab again, wiggle, wiggle, wiggle. Find as much of it as you can there, and then we're gonna go to the front side now. Another little landmark is the pointy bone on the front of the hip here. We'll go right inside of that. Grab the skin in the front of that bone, wiggle, wiggle, wiggle again, maybe do some pivots, some hula hoops, whatever it is, okay? If all the areas that we just covered is not your hip area that you're feeling, grab the skin right over where you usually feel your discomfort, okay? It might be a little lower in the crease, might be a little more side butt here. I don't care where it is, just grab it. Grab it right on top of where the pain is, wiggle that skin, move around a little, and then retest, okay? Retest your bending forward, your squatting, whatever it was in the beginning that you tested for your discomfort, and see if there's a change there. It shouldn't be perfect, okay? You may notice a little bit of a difference though, like what the heck did that do? Why did that work, okay? We're not going over why in this video, but I want you to know that if that did work for you, maybe this next thing will help as well, or we are the people that you should come and discuss your issue with. Will help guide you in the right direction of what's causing this hip pain, okay? Last thing we're gonna try is what we call wall taps, okay? So for purpose of the video here, I'm gonna say that my left side is my hip issue, okay? And I'm gonna come up near the wall here, and I'm gonna put that hip issue up in front here, okay? So left hip is hurting, left knee is the one that is up. And we're going to slowly start to find a bit of a hinge and then out of it, okay? Sit back and out of it. And we're just gonna slowly work through this because some of you, maybe even just a little bit of this hip flexion here is a little provoking, okay? Again, if you're trying this and you didn't try the skin pull, try the skin pull before you get into this to see if it actually helps you. Okay, so we're just gonna learn how to sit back, close a little drawer with our butt, and slowly come out of it. The next part to this, once we feel ready, is hold, reach, tap the wall, and come out. Close the drawer, reach, tap, and come out. And we're gonna keep going through this until we feel our glute is starting to work on the side near the wall. And come out of it, okay? I'm gonna see if my camera angle will get me while I'm standing as well. It does. So we can take this and we can make it foot on ground as well. Bend into the knee, reach forward, tap, and come out of it. Again, last time, bend, reach, really long, tap, and come out of it, okay? From the front side here, what it should look like is reaching across our body and coming out of it. Bend, reach, tap, and come out of it. And you'll feel a lot of side glute working there. If we're stuck now, or not stuck, but if we're still on the one where we're on our knee on the floor, from the front side, this is what it should look like. Sit back, reach, tap across our body, and come out of it. Again, what we're looking for is side glute happening on you, okay? If this feels a little tricky, if it's too painful, if none of those were working well for you, again, you fall into that category of you need better individualized care, okay? We can take those exercises, give you the cues that work well for you, and find the way to get you to feel what you need to be feeling, or we change that exercise altogether, find the one that works best for you. We go back to squatting, we go back to bending forward, we notice a difference, that's the path we're going down, okay? So the most important thing here is find a challenging rehab that works for you, one that you actually walk out the door feeling better, okay? Not perfect, but better, at least in the first few visits. Get the right diagnosis is the second most important thing, and find simple, small habit changes that we can incorporate into our life going forward, okay? So if those exercises worked well for you and you wanna know a couple more, our YouTube video has tons of them that you can try out. Best thing is just to reach out to us, okay? I mean, you can search through YouTube all you want, but there's too many people who spend years doing that stuff and they're in pain longer than they need to be. Your best bet is to reach out to us. Let us guide you in the right direction. We're here for a reason.